Ladies and gentlemen, welcome to International Smart Healthcare Forum. Before the event starts, let me share some information for you. This year's Smart City Expo will be delivered in online to offline model. The online portal of Smart City will serve as an extension of professional exhibition that features scope, smart life, pavilions, and matchmaking, allowing global stakeholders to participate remotely and always stay connected. The upcoming 2021 First Smart City Summit and Expo, which is scheduled from March 23rd to March 26th at the Taipei World Trade Center, Nangang Exhibition Hall 2. And Joint Commission of Taiwan has set up a platform named HST, Health Smart Taiwan, which provides smart medical solutions and products. Here comes more information of HST.
In order to integrate the capabilities and resources of medical care and ICT, the Joint Commission of Taiwan has established a platform named Health Smart Taiwan, also known as HST, for sharing the information of Taiwan's smart healthcare innovation. HST helps both healthcare and IT industries to find the resources and develop medical technology products that meet medical service needs. Moreover, HST provides a channel for these two high-tech industries to interchange and accelerate the development of Taiwan's smart healthcare and globalization. Taiwan has been developing smart healthcare for a long time. This can be attributed to two factors. First, we have a huge database of national health insurance. Second, we have a strong ICT industry. Taiwan has been recognized as the best healthcare systems in the world, which is according to CEO World. Based on that, I believe it can make Taiwan more competitive in the near future and bring substantial growth in the smart healthcare industry. HST can help hospitals to find the products that meet their individual needs, moreover, to find the solutions to deal with their problems. Taiwan has brought the international attention to its ICT accomplishment. Through the combination of the medical care industry, the contribution to mankind will transcend the previous Taiwan ICT industry. It is because of the popularity of ICT, Taiwan plays a key role in this field. After putting on a VR head-mounted display, regardless of whether you are performing neurosurgery or heart surgery, you can use VR to provide family members with an immersive experience that will ensure that they understand your explanation. Actually, at the Medical 4.0 stage, the operating room is most in need of integrated technology. The overhead Unicar electric track vehicle can completely separate used and unused instruments, reducing the risk of cross-infection and achieving the goal of zero contamination. It also puts our space and manpower to the best use. These medical transportation robots can shorten the time to 5 minutes. That lets nurses spend more time on caring for patients in the operating room. Currently, the time spent caring for patients has increased from 75% to 90%. The global smart healthcare trend is still going strong. Taiwan's healthcare industry is a key factor leading the Taiwan economy into renewed prosperity. HST is a platform that was developed by JCT that gathers smart healthcare resources from industry, government, academia, research institutions, and the medical sector, and also serves as a channel for international contact and interchange. It has brought Taiwan's healthcare industry to the world stage. The next step is to implement pioneering projects on precision medicine, which will accelerate the development of smart healthcare. Our future competitiveness will be based on outstanding ICT, an outstanding medical environment, and sufficient cooperation. We are confident we will achieve competitiveness at a high level.
Okay, thanks for watching. And after the session, please provide your feedback of this session by scanning the QR code below. Thank you. Okay. Now, ladies and gentlemen, our online distinguished guests and partners around the world, my name is Penny Ping. On behalf of Joint Commission of Taiwan and Taipei Computer Association, it's our honor to welcome you to the fourth session of International Smart Healthcare Forum. Thank you all for joining us today. The Smart Healthcare Forum is one of the largest medical and health technology industry online to offline event in Asia. Since 2018, the Smart Healthcare Forum has been a key event for industry leaders, innovators, and investors to discuss the future opportunities within the medical technology sector. With the trend of ultra-fast 5G, mobile wireless, AI, and big data analytics, the Internet of Things, IoT, is gaining traction in the healthcare industry. By leveraging the IoT technology will likely revolutionize the healthcare industry in the coming decades. The growth of AIoT in the healthcare industry will transform the way patients are monitored and treated. This change will also improve the hospital management and service quality. The topic of this session is leveraging IT technology to deliver the future of healthcare. Taiwan has well known as its high-quality medical services and information and communication technology. We also call ICT. It has led the rapid development of Taiwan's smart healthcare. At the same time, many solutions have taken quality and efficiency of care into account. I believe this event will inspire you for more ideas. Let's create a safe and efficient care environment together. Okay, and now it's our privilege to have several speakers here with us to share their valuable experiences. Dr. Youcheng Jiang from Kaohsiung Veterans General Hospital. And Ms. Peggy Tsai from Kaohsiung Medical University, Chung-Ho Memorial Hospital. And the experts from the IT industry, Mr. Baron Xie, imedtac Company, and Ms. Pei Ying-wen, Maya International Company. Welcome and thank you. And during the event, if you have any questions or ideas, we welcome you to utilize the Slido. Please scan QR code on this screen and indicate who is your question for. At the QA session, we will select one or two questions to answer. For the rest of questions, we will reply you through email. And thank you for your cooperation. Okay, now I would like to invite Dr. Youcheng Jiang, Department of Critical Care Medicine from Kaohsiung Veterans General Hospital, who will be talking about smart digitalized intensive care medicine. Dr. Jiang, please.
Hi, I'm Youcheng Jiang. I'm from Kaohsiung, south of Taiwan. Today, I want to share some experiences in using digitalized data in intensive care medicine to improve quality of care and reducing clinical loading. Our hospital is tertiary medical center. It has 2,006 beds, 2,006 staffs, and more than 100 intensive care unit beds. Working in intensive care unit, physicians are vulnerable to attack by numerous information and overwhelmed by numerous data. So the information could result in decision failure by occupying our working memory. And so we need a more efficient digitized data to help us integrate all the information from daily practice. So here's my outline. First, I will introduce digitizing data in intensive care unit and share its benefits of this data used in daily care. Share 3 examples in applying smart share 3 examples about smart feature of this in the clinical information system. And finally, early warning system in preventing in hospital cardiac arrest. First, the most step of digitizing data in ICU is implement daily paper chart into digital information. So the left is our traditional paper chart by human record every day, every 6 hours or every 8 hours. The first step is digitize this data, but it has many problems to encounter. First is the hospital required Wi-Fi internet in every corner with relatively good quality. Second, our medical device have different company and different software. So the compatibility of this software in different company is important to overcome. After integrate this information, integrate this data into digitizing data, we have clinical decision support system. So digitizing ICU data is not only to configure system from paper chart into digital charting system. It has other benefits. The first, we have many systems such as clinical information system, PET system, can look image, NIS system, nursing information system, LIS, laboratory information system, and bedside patient monitor. This information was together into a CIS workstation, clinical information system station. This station can easily view comprehensive patient information from one computer, one screen. Second, after digitizing this data into after digitizing paper chart into digitizing data, we can monitor patient condition and every corner of hospital, even at home. In this period, if you got some common cold, the colleague we are afraid of you get some infectious disease, so you are asked to stay at home for several days. So you can monitor your patient condition and make some decision at home without working in hospital. And this information system can help us understanding patients' condition about catheters, lines, and skin conditions in one screen, such as arterial catheter and central venous catheter, urinary catheter, endotracheal tube. So, and we can check the durations of every catheter. If many physicians did not aware the patient have urinary catheter after several days. So using this system, we can remind every physician your patient's current condition. And clinical information system can help us get a quick view in one screen. This system has many informations in one screen, such as patient's hospital days, the laboratory data, the change of vital signs. So he can highlight high-risk patients to prevent deterioration. Finally, this data will be monitored every month for quality check. So if the infection rate increase, we will know something wrong. We can make some plan and improve it. We can see the global trend of data, and most importantly, we can use data to generate hypotheses for research purpose. And for example, this clinical information system has some smart features, such as we use this system to reduce ventilation-associated pneumonia. The ventilation-associated pneumonia is lung infection in patients with ventilator support. And bundle care is collect 4 to 5 evidence-based method to reduce the incidence of infections. So it's easy to start. So we only list the criteria, such as water in ventilation circuits, elevation of head of bed, and daily interruption of station, and ventilation within reminding information system. So these are our VIP bundle information criteria. The system will automatically check the patient's condition every day, every 4 hours, bundle check every 4 hours. And the nurse care will type in all this information to complete the bundle information system. Automatic winning reminding information system. Also, the left is traditional paper chart. We use this chart to check patient is candidate for winning ventilator. Now we have this information system assistance. The system will automatically check the patient condition every 24 hours. So he will inform physician for further evaluating ventilation winning. This is the effect of automatic check system. The y-axis is the incidence. The x-axis is the year. So you can see a clear trend to reduce these infections. We create clinical information systems in 2014. Ventilation-associated pneumonia is continued to decrease. Second, we use this clinical information system to reduce catheter-related associated urinary tract infection. Similar to previous bundle care, urinary tract infection has its bundle care system. So these are its criteria. So hand hygiene, daily body care, and empty urine bag, and secure the catheter, and do not touch the bag on the ground. Such in criteria is easy to make an algorithm to automatically check the condition. So we also have 5-day reminding system. About 40 physicians did not aware their patient has urinary catheter. The longer catheter placed, the higher infection rate. So it's important to remove the catheter as early as possible. And we create this information reminding system. If patient consider place more than 5 days, we log in our health information system. The system will alarm us the patient consider is more than 5 days. So the result of this bundle care, so we can see the incidence of infection is continuous decrease after 2014, and the effect is maintained until now. The third is central venous catheter bloodstream infection. These three infection is most popular, most common in intensive care and associated with incredible mortality and morbidity. So the bundle care information system of central venous catheter is such as this. We have central venous catheter information, the site and duration. And bundle care is hand hygiene, chlorhexidine care, use subclavian and interjugular vein as possible, early remove of the central venous catheter. So after we create this criteria, the system will automatically check the patient's condition to remind us to remove the catheter as early as possible. So this is a result of clinical information system about in reducing bloodstream infection. And finally, I will share some experience in preventing in hospital cardiac arrest. In hospital cardiac arrest is associated with very high mortality. Only less than 20% patient will survive to discharge. More importantly, these patients have some signs or signals before in hospital cardiac arrest. So if we design a system could early detect this change, we maybe help the patients without INCA occurrence. So the system is early warning system. It detects early signal and notify the medical personnel, and we will evaluate the patients immediately to check the information is right or right or wrong. Some warning signal is due to is result from error typing in nursing care. So we need doctors check the patient condition immediately. So if the signal is right, we will do something diagnosis and treatment immediately. So we can prevent or reduce in hospital cardiac arrest. There are two major systems in warning system to reduce INCA. One is news, and second is clinical alarm system. The major difference is news is early recognize patient with potential to deterioration. The clinical alarm system may have many indices, and maybe some indices is too late. So we choose the news system to create our early systems. We also add the most important. Our system has Glasgow coma scale and oxygen, peripheral oxygen saturation. Besides this automated calculation system, we also implant this warning system in every station's computers. If when you work in the world in a night shift, you can see all the computer screensaver has the deteriorated patient data. It remarks flash red light, so you can monitor all the patients in one screensaver. So if the patient deterioration, early warning team will call the duty doctor to make some diagnosis, make some treatment. And we will announce every new colleague about this system. So the primary outcome is the rate of in-hospital cardiac arrest. After implement these systems, the rate is decreasing every year. The incidence is also decreased. More interesting, the incidence and INCA, the onset, the incidence and rate of INCA between the night shift is also decreased, or not only daytime, but most importantly, in the night shift, the staff in the hospital is only few duty doctors, so he has to deal with so many patients. So if we can use this information system to reduce his loading and running, and specifically allow him to monitor some patient, the system is work. So the incidence and rate during night shift is also decreased, and decrease in the holiday. Also, this is our some experiences in implement clinical information system in critical care medicine. Thank you for your listening.
Thank you, Dr. Zhang, for your marvelous speech. And next, let me welcome Mr. Baron Xie, Business Development Manager, imedtac company, who will be speaking on introduction of smart healthcare and smart hospital solutions from Taiwan. Baron, please.
Hello everyone, I'm Baron from imedtac Taiwan. So I want to introduce you some of our intelligent of smart healthcare and some smart hospital solutions in Taiwan already done. Okay, so I will introduce our company and why we want to do the intelligent smart healthcare at first. Actually, you may know because since the collaborator already introduced that we are in Taiwan, we are very good at ICT technology and even the medical service. So actually, we want to combine these two advantages of Taiwan. Because we want to, actually in the past, medical service is quite different from the IT service. So maybe the language we are using from the doctor to the engineer is quite different. So in the past, we cannot merge these two technologies together very good. But however, as soon in Taiwan, we have very good doctors, we have very good engineers, especially in ICT, IoT devices. So actually in this time, we want to combine these two and become an intelligent healthcare. So that's our goal of our company. We want to provide a combine the doctor's experience, nurse experience, and with this all new technology like IoT, IoT device, cell phone, or some computer things. And we want to combine it into intelligent service to install in the hospital, and then use this technology to help people, to help the doctor to provide better service and provide better efficiency in the hospital and healthcare. So we must do, what we do is we are doing system integrators, we're doing some solutions on-site optimized, and of course all the activities working on the cloud. So all the data will be memorized and become log. So you can trace in, you can recheck, and you will know how to improve in the hospital. So this is our goal. We want to build an intelligent hospital. So we have some strategy to doing that. Our first one is the patient-oriented. Actually, in the past, we will call in the hospital is doctor-oriented. It means if I'm patient, I go to the hospital and I'm doing everything because the doctor or the nurse told me what to do. So actually, I'm quite nervous. I don't know how much time and how much treatment I will get. So there's some study says if become a patient-centered, means patient know what it's going to do, and it will improve the service care, and it will improve the quality. Of course, it will improve the time the patient will need to stay in the hospital. So we want to use this technology to help people, to help patients get more information from their treatment. And of course, we need to help the doctor, help the hospital work very efficiently, and of course, very expert and no mistake in their clinical trial. So we have many solutions to provide patient certification, to provide some information interaction, and even some log, even some AI, or even some robot application. So I will introduce a very common, and actually it's quite common in Taiwan, but I want to improve and introduce all this model to worldwide abroad. So it's like a smart world scenario like this one. If you are walking into the lobby in the outpatient area, we have some broadcasting system, queuing system, and we have some like a smart clinic. We will know how many times you need to wait to see the doctors, and we will know how to go to the clinic room. So everything you can use your app or even use the kiosk to get the right information. And all the action you're doing in the outpatient area will send back to the HIS. So in the inpatient area, they will share with some dog. So once you need to live in the ward, the nurse or the caregivers in the nurse station or in the hospital, they will also get the history data. So we'll call the nurse station that will become like a control centers. So the nurse in the nurse station will know everything about this patient. Of course, we'll share and transfer all the information and the treatment to the patient through this system. So in the nurse station, there are many solutions like a smart nurse station, like an automatic dispensing cabinet, even some e-papers charge, and e-paper signage phone. And in the ward, we have some terminal to show the patient information, so you don't need to write down the patient information manually anymore. So it will even add a lot of some sensors, like a smart time of flight sensor on the ceiling. You can monitor the patient status, and we have some smart metrics on the bed, so you can measure and analysis the patient is moving, leaving the bed, or keep the same gesture on the bed. So maybe once you keep same gesture for too long time, we'll ask and will in a warning send to the nurse station. So nurse will go to your ward and provide some suitable service. Okay, so I will introduce these solutions one by one and share with you how we already done in Taiwan and what is the solution I just mentioned in the past, just a few slides before. And the first one is the vital sign kiosk solution, related solution. It mostly is put into the lobby. So actually in Taiwan we have in the past we have many blood pressure service, blood pressure machine just put onto the outpatient area. So once, especially a chronic patient, once you go into the clinic, you must measure your blood pressure, measure your temperature by yourself. But in the past, we normally just write down the information we just got and go to the clinic room and tell the doctor what I just measured. So actually it's quite time consuming, and sometimes we were writing down some wrong information, and sometimes you will just forgot. So the doctor in the clinic room need to recheck that again. So actually it's quite time consuming. Since in Taiwan we have a common problem, maybe you already have it means in the hospital they are very crowded. So many patients waiting out of the clinic. It costs, not everybody can talk into the doctor for a very long time. The average time in Taiwan for a patient to see a doctor in the clinic is around, I think, 3 to 6 minutes. So the time is very precious. We want to use this time more focus on the doctor treatment and doctor examination to the patient. So we just use this kiosk, just put everywhere into the hospital. So the patient, once you get into the lobby, get into the hospital, you can measure by them yourself, and you can even register with this kiosk. So in Taiwan, we have a national insurance card. We just put in, and the system will get all your information and send all the information back to the system. And we even sell this one into Thailand, Vietnam, and all the content in this country will become the local language. So we have some UI like this one, and actually it's a quite big screen, so we have audio and text instruction. So it will tell you how to operate one step by one step. And of course, all the data will send to the cloud, so it means you will have some big data application. For example, you can do in the online to offline service, or some guiding you to how to some promotion. For example, if I have a too high BMI, maybe the system will suggest me you need to buy some healthy food, something like that. Okay, the second one is the EPD and also being the smart world nurse station. So right now we use the EPD e-paper display to become a display to put into the world. So in the past, there were some papers just stick on the bedside or bedside and to write down every information about this patient. So right now we use the e-paper display. It's all linked with the Wi-Fi. So once the patient status is changed, the system will update it immediately. So all the information displayed on this will become the latest and no mistake. So the doctor or the nurse, if you are going to check in with into the world, you can just see, okay, I know every information about these patients. And there are some buttons on this display. So even if you can press it for nursing code, and they have some NFC readers. So once some doctors come in, you can scan their badge, so they will tell the system, okay, there's some doctor or some nurse going to the world to provide some service, and actually it will become a log. So in our language, we call it like you provide a closed loop. It means every task happen in the world will have a memorize. We memorize the time and the task, and send to the server. And once someone like some doctor or some nurse going to solve this task, it will also have some log. So every action in the world will memorize with this terminal and this solution. And as you already see, we have several size from the 7.8 size to the 42 inch. Okay, we have several sizes into several applications. For example, for the 42 size, we usually use in ICU or some VIP ward right now in the United States. Okay, so it's some real picture we already done. So you can see this is a picture we installed this digital signage paper into the Taipei University of Medical Hospital. Okay, and there's all the information will send back to the nurse station. So the nurse in the nurse station will receive some warnings, some instruction, and even if they got some apps, nursing apps, we will also pop out some information on the nursing app too. Okay, this is some detailed instruction about our solutions. You can see like a terminal, it will show some basic information like patient information, doctor information, and some warning about this patient. Maybe this patient cannot work, maybe cannot eat, or easy to falling down. We have some sign on this display. And we even have some button interaction on the button top. So you can see there's some nursing code, IV code, or some emergency code, even some wrinkling code, and with one NFC readers to get the log. Okay, so this is the dashboard in the nurse station. So all the information you just saw from the digital paper on the patient bedhead will send back all the information to this nurse station. So nurse in the nurse station in the past, maybe they will have a big whiteboard and manual write down everything they need to memorize and they need to focus. So right now we link every system from HIS, Hospital Information System, Nurse Information System, Laboratory Information System, and integrate all the information system on this intelligent dashboard. So the nurse in the nurse station just can press or log into the system. They will get every information very quickly. And so all the tasks from the world also will send back to the nurse station. That's why we call the nurse station will become a control centers. So all the information will pop out like this one. So no more big whiteboard, no more maybe a lot of papers. So the nurse shift right now in Taiwan is become very quick. They don't need to drag out all the material to discuss when they are doing the nurse shift. They just press and get all the information they want to make sure. And we even have some e-signage paperless solutions. It means we use the same technology, the e-paper technology, but this one with the signage function on it. You can imagine it's a big Amazon Kindle with signature function. So we use it for the digital paperless application. So there will become no more real paper anymore. So we upload all the information sent to the platform, and you can just sign, check every system, every papers on this platform. So it will become all digital sizes and no more big storage room right now. Because since it's very expensive to purchase, to build a storage room in Taiwan, like Taipei. So that's why I want to help the people. Okay, so into the world. In the world, we have many sensors. So this one is one of our sensors. It's use advanced technology like named time of flight, TOF sensors. So actually, it can measure the shape of every items into the world. So we can use the AI algorithm. We can know which or where is the patient is. Is he on the bed, standing behind the bed, or even falling down from the bed? So this information, these sensors with some 3D depth information. So we will know the shape, and we don't get RGB information. That will fit the law. Because in the law, in Taiwan law, we cannot put a camera in the patient room. So with these sensors, we can detect the patient status. All the information will send back to the nurse station you just saw. So once, for example, once a patient leaving the bed at midnight, and this patient is easy falling down. So actually, in this time, they will send a warning back to the nurse station. So the nurse, night shift nurse will know, okay, we got some problem or some warning. It means that some patient is going to leave in the bed, so they need to check out, to go to his ward to check if he's okay or not. And this is some platform we already use. So you can see there's like a map. How is the patient? Like we're calling it like living map. So we will see when is the patient lying on the bed, when is leaving the bed, something like that. All the status will pop out and memorize in the nurse station. And actually, nurse didn't need to see everything about it. You just get the warning. So if some task you are setting to warn, so they will pop out warnings like this one. And there's another sensors into the nurse, into work, sorry. This is a mattress on the bed. Actually, I will call it as a bed sheet because it's very thin. It's around 3 millimeters thick. So you can put on every bed you already have under the bed sheet. So it's a pressure sensing device. We have around 220 elements on each bed. So you will measure the pressure distribution about every patient. If this patient stay in the same gesture, for some stroke patient, they cannot move. So some pressure wound will be occur in this situation. So once if the pressure distribution keeping in the same spot, we'll send some warning also to the nurse. So the nurse can go to the ward to provide some massage to this stroke patient to provide the pressure wound. And of course, also can measure if the patient is on the bed or leaving the bed. It's with the same functions. Okay, so that's another solution we already done in Taiwan. Actually, in Taiwan, we calculate every mistake happen in the hospital every year. The first mistake in the hospital is the people falling down. It's a major problem in the hospital. The second problem is the medication delivery error. So we made this automatic dispensing cabinet to control the restriction drug like morphine, like sleeping pill. So in the past, maybe they will have some big closet with 2 keys, with 2 locks. And for maybe 2 experienced nurse, they need to go to the lock and open this closet at the same time. So right now we will use some technology to help to improve this service. So we use some badge sensors. We use some face recognition. We even use some face ID, finger ID, van ID. You can measure and you can recognize which doctors access this cabinet. Okay, once these users was identified as a registered person to use this cabinet, the system will link to the pharmacy system. Then we'll know when, for which one, to get what medicine to which patient. Okay, so all the access activity will become a log again. So we will memorize that. You can see so one step by one step identification, enter the prescription, and get the right medicine. So normally we'll install into some ICU, some operation room, emergency room, or some illness, mental illness clinic, because there's many restriction drugs there. So we use this one to provide the medication area. So actually, we start our company from Taiwan, so there's some successful case we already done. And most Taiwan regional and medical centers hospital is our client. And we even have explore our business into China and even into worldwide abroad. Right now, in Southeast Asia, like Asian country, we have some connection. For example, in Thailand, in Vietnam, and right now we are going to explore our business into Singapore. We even have some collaboration in the United States and in Europe. And there's some real case we already done in the worldwide. We install our machine into Thailand, and one of our customer, we use our machine to go to the Vietnamese local television show. So with that, they got a $700,000 USD funding. So right now, the company is a famous company in Vietnam right now. And actually, this picture, although it's a cartoon map, but it shows all the solutions we already done in Taiwan. And one special facility is that our solution is modularized design. Since not all the hospitals are brand new hospital, so sometimes they need to only choose few solutions. But we know these problems, so our solutions designed for modularized. So you can choose what you want and install in the right position and the right clinic. And you don't need to change all the hospital at the same time. That's one of our strengths. Okay, so you can see from the lobby, we have some robots, some broadcasting system, and into the inpatient areas, we have some smart nurse station, control the smart ward, and the same idea will control like a dialysis room, operation room, and we even have some logistic solutions into the hospital. Okay, this is some real picture already done in Taiwan for some fancy ward curing and some robot application. So that's mostly my introduction of our smart healthcare solution we already done in Taiwan. So if you are interested, if you have any question, please kindly advise me and help you. Thanks for your time. Thank you.
Thank you, Baron. And next, I would like to welcome Ms. Peggy Tsai, Project Assistant from Kaohsiung Medical University, Chung-Ho Memorial Hospital, who will be speaking on implement new technology in negative pressure isolation wards. Peggy, please.
As we all know, coronavirus is surging across the world. Up to today, there are already more than 40 million confirmed cases and 1 million deaths around the world. Every country is taking everything they can and taking measures in suppressing the outbreak. As one of the leading medical university centers in the south of Taiwan, we are always in search of new technology and have invested a great deal in AI technology, big data, and 5G network. We've applied this technology into our healthcare system, not only to provide the best quality and advanced care and treatment to our patients, but also it is very important to protect the safety of our staff, providing them with a safer working environment. That's especially during this period of time. We are playing an important role in pandemic management in Taiwan. Coronavirus is highly contagious. To protect our patient and our staff, we have installed a radar sensor in our special wards. It is a standalone device and can be set up easily. It only requires a computer as the server and internet cable wiring. The device is highly sensitive and also low power consumption, high accuracy, and also at an economic pricing. And also through the zero contact, it can detect vital signs as respiratory rate, heart rate, and body temperature. In addition, it can also monitor the body positioning of the patient without invading their privacy. So in this case, we are able to use this device in the bathroom and the toilet area. Whenever there's an emergency situation, our medical staff can react immediately, since they are able to monitor the health condition of the patient from the nursing station. With the help of the device, our healthcare staff doesn't need to enter the isolation ward to check on the vital sign of the patient as frequent as before. It actually reduced the infection and transmission risk for them. At the same time, the stress level is decreased and their morale is increased. Also, each time when they enter the negative pressure isolation wards, they will need to put on personal protective equipment. Sometimes they have to wear personal protective equipment in several layers. It is not comfortable, and it is quite stuffy. And of course, it increases a lot of waste to our environment. So currently, we are using this device in our I-131 isolation rooms. And also, this is used for in treatment for thyroid cancer patient. And then, of course, in our negative pressure isolation wards. And as you can see from the photo, you can see the device is actually on the ceiling. And all of our nursing staff, they can monitor the condition of the patient from the nursing station through the computer. Okay. And so, besides this application, right now the device has been used in animal husbandry, such as in dairy farming and also pig farming, to monitor the temperature of the animal in the United States. And also it can be used in nursing home and telemedicine. And in the near future, it will be used in smart home application. And right now, I would like to play a video for you sharing our experiences.
Coronavirus is surging across the world. Every country is taking measures in suppressing outbreaks. The painful lesson of SARS outbreak, along with the efforts by medical professionals, have made Taiwan the safest country during COVID-19 pandemic. As one of the leading medical centers in the south of Taiwan, Kaohsiung Medical University Chung-Ho Memorial Hospital is the first to use a non-contact vital sign radar in isolation wards.
COVID-19 这个病毒，它的传染力其实是非常强。
COVID-19 is highly contagious. It can be transmitted through droplets or contacts. Initially, we've used the device in radioactive iodine therapy isolation rooms to monitor the body temperature, heart rate, respiratory rate, and body positioning of patients. During COVID-19 pandemic, we've also started using the device in negative pressure isolation wards. The non-contact vital sign radar not only provides accurate reading but also affordable. Via zero contact, vital signs such as body temperature, heart rate, and respiratory rate, and body positioning of patients can be detected.
那透过这一次 COVID-19 的话，尤其是在
During the COVID-19 pandemic, the device allows us to detect vital signs without contacting patients and protects our healthcare staff. In addition, it increases the patient's safety and protects the privacy of patients. We have received positive results in the usage of the device.
安全方面都有非常好的一个效果。
在硬体的部分，它有这个。
It is also integrated with thermal imaging sensor and radar to detect body temperature, heart rate, and respiratory rate at the same time. The privacy of patients will not be violated. The device has reduced the frequency of the healthcare staff entering the negative pressure isolation wards to check on patients' condition, which decreases the infection and transmission risk for them.
之前的话，因为要进出
Before, we need to check on each patient frequently, especially when their condition are not stable. It is very hot and stuffy when wearing PPE. This system has made my work more efficient. At the same time, I'm still able to monitor patients' condition and safety.
每次进去接触都会
When I go in each time, I do feel some pressure. My emotional stress is reduced with the help of the device. We are still able to provide the same level of care to patients. Kaohsiung Medical University Chung-Ho Memorial Hospital takes action in caring for their patient and their staff. Visitor can feel safer.
我们最怕的就是医护人员可能在跟病人
We
在接触
worry and are afraid of coming to the hospital. The healthcare staff has higher risk of being infected due to the direct contact with patients. It makes us feel safer when the hospital is making extra efforts.
也怕会有传染问题
I would feel better if there's no direct contact. Anti-epidemic has become a mutual goal of all people. Kaohsiung Medical University Chung-Ho Memorial Hospital focuses in patient-centered care as their mission and responsibility. Use AI technology in healthcare industry. It plays an important role during this critical period of time.
对于医疗的 AI，
We have invested a great deal in AI technology, big data, and 5G network. By applying these technologies in our healthcare, we will be able to continue providing the best quality care to our patients.
利用现代的科技那变成一种环境监测环境监测。
By using the modern technology, it allows us to monitor patients, visitors, and the environment, and achieve our purpose of medical care to our patients.
达到这个医疗照顾的目的。
Adopting digital technology and integrating it into healthcare, Kaohsiung Medical University Chung-Ho Memorial Hospital is a powerful support in pandemic management in Taiwan, guarding Taiwan and guarding the health of our people.
Thank you for your time to listen to my speech, and thank you for joining us. Thank you.
Right, thank you, Peggy. Then let me welcome Ms. Pei Ying-wen, Project Manager from Maya International Company, who will be speaking on establish a continuous smart care system by using health information technology. Ms. Wen, please.
Hello, everyone. Thank you for being here. My name is Jun. I'm a project management of Maya International Company. And actually, I'm a nurse. Okay. I'm so glad to have this opportunity to share our smart healthcare information system to you. Today, my topic is how to implement continuous smart healthcare system by using health information technology. I hope after this talk, we should think more about how to improve healthcare and do it smartly. I will divide my presentation into 3 parts. The first part is about our company. Next, I will be introduction our hardware. We call it vital gateway. And finally, I will also introduce our software, that is the nursing information system. First of all, Maya was established in 2002. We are a software information and a technology service company. We have developed various platforms for managing clinical information, medical information, and health promotion. We also integrate some hardware into our programs, so patients' vital signs data or other clinical parameters could be synchronized and shared with our system. Okay. For clinical IoT integration, I will talk about our product. It's called Vital Gateway. This is a small size and touch screen equipment that is able to integrate various clinical medication equipment and physiological measure equipment. The most important part is it can automatically retrieve and upload clinical data to the nursing information system by the built-in Wi-Fi. It enhances the clinical quality, streamline the workflow of the clinical care, and share accurate clinical data without delay. As you can see, this slide, Vital Gateway is able to connect with more than 250 kinds of medical devices. The gateway could pair up and get the data from medical equipment, including hemodialysis machine, ventilator, and physiological monitor. All this medical equipment, which is used in various departments, such as the operation room, emergency room, or inpatient unit. They are let's give you an example in the world area. Vital signs gateway can mount on a non-invasive vital signs measurement equipment. As you can see, the gateway can capture the data such as the patient's blood pressure, pulse, oxygen, and from the machine, and then can auto upload to nursing information system and create an electronic document as shown here. So let's talk about our nursing information system. That is the NICE. NICE is one of our Maya medical specialist system. There are 5 hospitals and 2 hospitals in Hong Kong implement our NICE. In order to meet the now medical standard or quality requirement, there are these hospitals accredited with JCI and pass the HIMSS certification with the implement of NICE. Actually, current healthcare industry are more focused on quality, efficiency, and as well as safety. Different countries also promote the idea of smart healthcare. Smart hospital rely on sharing and using of information and communication between all those technology-based environment. Especially of our needs, it can streamline the clinical workflow, create various kinds of medical records with accuracy, so the clinical staff can spend more time on patient care. Apart from this, during COVID-19 pandemic, the nurse is required to wear personal protective equipment all the time. Sometimes they feel difficult to use the keyboard when using the NICE system, so they can use the voice assistant to access the NICE and open various records. The voice assistant is Maya and Westron cooperated to develop. By showing this slide, you can see our NICE main screen. And actually, we have adopted different models of a patient journey in some local and overseas hospitals, so as to make it easier and more user-friendly when using the NICE. As you see from left to the right, different functional buttons is laid out here from admission to discharge. On the other hand, nurses can use NICE to facilitate their clinical care across departments. They can submit laboratory X-ray requests to related department based on the doctor's prescription to create referrals to other health department, even create transfer summary for the handover of patients to the next caretaker. Maya NICE system can make the healthcare system become smarter in terms of the following advantage. First, NICE is a program that has a comprehensive nursing process loop. We have really tried to integrate to the daily activities of nurse in this system. Staff can complete many clinical assessments and get the work done by their data entry. For example, like for risk, pressure ulcer risk, intake and output records, and tube and drains assessment. After finish this assessment, NICE is able to provide clinical alert based on their other high underlying setting. This enhanced function and alert message is tailor-made based on customization. It can notify the user to provide some suggestions, such as take prevention measures or consider other intervention or care. It can facilitate decision making during the daily clinical workflow. All the NICE records and and the vital signs data can be exported to the multidisciplinary progress node. All other required documents. It minimizes the transcription in daily work, as well as reducing the nursing workload and reduce the chance of transcription error. This is an evidence-based approach and develop different care different care plan and the clinical pathway. Provide user to a protocol care driven, such as a pain assessment or pressure ulcer assessment. Well, this is a real-life healthcare environment in Hong Kong, and in this world, apart from the desktop computer, nurse can use a different approach to assess needs, including the computer on wheels or tablet device. One more important function, the dashboard mode, is an electronic dashboard. Is also built in on our needs. This is an all-in-one clinical screen that integrate many information, clinical data showing in one screen. You can see the left-hand side. You can look into how many patients at high risk, like fall risk, pressure ulcer risk, and in poor nutritional situation. And you are able to how many patients have pain and drug allergy. Patients' data is shown in each box real time. Nurse and administrators can get accurate and complete information from the dashboard. During the COVID-19 period, we modify our needs system, and now we can make sure all the data from the initial admission assessment and retrieve all those infection control assessment, which is the FTOCC screening. You are now looking at this screening. We are also showing the individual patient's infection control status and a summary of the unit. Okay, finally, MyAnis can help you to create more intelligent clinical working environment. This is the end of my presentation. Thank you for your listening.
Thank you, Ms. Wen, and thanks all the speakers for the excellent speech. And now we are open for questions. Whether you are online or on site, please go to slido.com, and you can type your questions. And please let us know who is your question for. Okay. So due to the limited time, we will select one or two questions to answer, and other questions will be replied by the email you provided. Okay, so do we have any questions now? Janice? Okay, thank you. Okay, we have one question for Dr. Jiang. There are many medical instruments on the market that have their own systems. How do you integrate them into HIS and NIS? And have you hired any engineers or commissioned a vendor to build an information system? Does the information vendor understand the needs of the hospital? Dr. Jiang, please.
integrate of this system by our hospital's IT department. So we did not hire IT department from other company. So we have the negotiate the medical requirement and the IT viewpoint is important. So some of our colleagues is master in program language and how to design the system. So we can talk with our colleague master in language in program language, so they can work better with our IT department.
Ian, so thank you. Thanks for your answer. And we have another question. Okay. Okay. We have another question for Ms. Tsai, Peggy. The use of monitoring devices reduce the actual interaction between medical staff and patients, whether it will cause dissatisfaction of patients and feel abandoned. How do you balance the feelings of patients and the safety of medical care? Peggy, please.
Thank you for the question. Actually, there's no worry about that because we still have like a telephone. When the patient has a need, they will always constantly call the nursing station. And our nurses and our medical care staff, they can always enter the isolation ward to help them with special assistance. What we are using this device for is like we reduce the routine, like a vital sign check. So we can reduce the risk for our staff. So if there's no worry, they will feel abandoned because we are still constantly monitoring their health condition and also caring for their feeling as well. Thank you.
All right, thanks for your reply. And we are almost running out of time, so this will be our last question. Okay, this question is for Dr. Zhang and Peggy. When hospitals employ IoT, what are the prerequisites needed in the full implementation of the system? And what about the hospital not ready for this system? Okay, Dr. Zhang, you want to go first? Thank you.
In practically, the most important is the financial support and the director of department's agreement. This is most important steps. So, and then our hospital have been built for 30 years. So some hardware is very old. So we have to gradually change into newer hardware. So it takes many years. Wi-Fi, the internet, the problem we have deal with, the most problem is Wi-Fi problem, and the second is such as we have to upload our ventilator data to our into our information system. It's a big problem. So we spend months to deal with it. I have two solutions. One is complex but more cheap. Two is very expensive but more quick and simple. So in our practical opinion, financial support and director of department is very important. And so, thank you.
Thank you for the question. First of all, when we employ an IoT equipment or a system, we have to look at our internet foundation first, because we have to have a complete built internet. Otherwise, it would be difficult for us to provide the best solution and use the IoT in the best way they can. And also, there's another important issue is the firewall. Okay, because there are a lot of data in our hospital system. Any danger, like if there are hackers or like a virus attack our computer system, attack our system, it will jeopardize our system may collapse. So it's very important to look at those things first. Thank you.
Okay, that's brilliant. Thank you. Okay. Then, ladies and gentlemen, this concludes our section. And please stay tuned for our upcoming events. On November 4th and 11th, International Smart Hospital Leadership Forum will talk about apply resilience healthcare to address the challenges in the post-pandemic era and application of smart technology in infection control and healthcare worker safety. And we are hoping to see many of you there. And this is the end of today's event. Thank you very much for joining us. And don't forget to provide your feedback of today's session. And see you again in November. Bye-bye.